Good evening. We are live at 7 o'clock. I'm Stone Grissom, and welcome to our live coronavirus pandemic special report. Tonight, we have a doctor from Nassau County Medical Center to help you sort through what's going on with COVID-19 in our communities and across the region. And we want to hear from you. It is a call-in show, so call us at the number right there at the bottom of your screen, 516-393-1800. Now, before we talk to the doctor and start taking your calls, it is 7 o'clock. News 12 Long Island would like to join the rest of the country by clapping because we care. This is our way of saying thank you to all of the essential workers out there. So thank you. Let's start off. Thank you, Deborah from Yaphank. And thank you, Franklin from Brentwood. Thank you, Jim and Willie from West Islip. And thank you, Jocelyn from Selden. There she is. And thank you, Joseph from West Islip. Thank you, Ken from Shoreham. Thank you, Matt and Caitlin from Lindenhurst. And thank you, Matt. There they are. And thank you, Matt from Seaford. And Matthew from Franklin Square. And thank you, Paul from Medford. And thank you, Zaith from Kings Park. Now, are you a nurse, a doctor, a grocery store employee, a restaurant worker, dry cleaning employee, a bus driver, MTA employer, any other kind of essential worker? We want to hear from you. Send us pictures of the essential workers in your lives. All we need is a picture. We need the person's name, and we need the village or town and what the person does for a living. And every night, right at 7, we're going to join the nation thanking the people who have been on the front lines during this coronavirus pandemic. Just go to News 12's Facebook or Twitter pages and let us have those pictures. All right, let's get right to it. Don't pass the buck without passing the bucks. Governor Cuomo sparring with the president today, inferring that reopening guidelines President Trump recently announced, shifting the financial burden of reopening the economy to the states. Cuomo says you can't give the states that massive undertaking that's never been done before and not give the states any resources to do it with. And those bucks the governor's talking about are needed for massive testing to begin unpausing the state. He says the state is to get 300 private labs and hospitals to become one system statewide to do testing for COVID-19. Cuomo issuing an executive order for the health department to coordinate with all the public and private labs to prioritize coronavirus testing. And the new mask mandate that goes into effect tonight. Starting at 8, everyone is required to wear a mask or a face covering in public areas where you can't socially distance. That's 6 feet or closer. The mandate applies to everyone 2 years and older. And that order also extends to public and private transportation systems. That's Uber and Lyft, places like that, as well as private for-hire services. And economic stimulus payments, those are being distributed by the IRS, but many Long Islanders say they're not receiving them yet. Now, the IRS says it's processed more than 80 million payments so far. Now, it's being reported that electronic transfers are being delayed in some cases. That's if tax filers used an advanced refund service or had tax preparation fees taken out of refunds. Tax experts on the island say it's good to use the IRS's new website to double-check the payment status and your personal information that it's up to date. And there is a push here on the island to keep our essential MTA workers on the payroll and keep those fares down. Today, Nassau Executive Laura Curran called on the feds to include nearly $4 billion in emergency funding to avoid MTA layoffs, service cuts, or fare hikes. The LIRR's president, Phil Ang, says there has been a 97% decline in ridership in the recent weeks. He says the full economic toll is between $7 and $8 billion in losses. That'll be through the end of the year. All right, that gets you up to date. Let's now join our discussion tonight. Dr. Anthony Boutin, Chief Medical Officer at Nassau University Medical Center. Thank you so much, Doctor, for joining us. Thank you for taking the time after what has to be an incredibly busy week and incredibly busy day for you. Let me start off by, let me just ask you, how are you and your colleagues doing right now?
Actually, we're doing okay. We're catching up. We had a difficult week. It's steady. Volume is still coming in. We still have a lot of sick patients in the hospital. People are pitching in as a team, a lot of teamwork. So we're doing really well right now.
Well, I know NUMC is really on the front lines, as you are on the front lines of fighting this pandemic. Tell us the role that NUMC is playing.
Well, initially, we tried to stay on top, ahead. So what we did was, we decanted the place to make sure that we had enough beds available for the surge that was coming in. We anticipated the surge because we saw what was happening in the city. So we decanted several floors, got them ready, and as the volume came in, we were prepared. We closed down, the surgical department, unnecessary surgery. We shut down, or at least part of our primary care, and we shifted the staff to the inpatient piece so that we can be ready for the onslaught of patients that were coming in.
Yeah, I know it's been a Herculean effort for a lot of people, and we appreciate that. Let's go to the phones and take some questions right now. Ann from Brentwood. Ann, are you there?
Yes.
What's your question tonight?
Hi, doctor. I have two questions. Question one is, if you are in the office and one of the staff members in the office was tested positive, is it safe to say that you should have yourself checked out too? And my question number two is, how long are we supposed to be, the person is supposed to be quarantined, and for you to find out if you're going to have any symptoms of that virus itself?
That's a great question. The answer for that, it changes on a daily basis depending on the CDC. If the person is positive, you wait 72 hours after they're symptom-free. If they're symptom-free for 72 hours, they can actually wear a mask and come back to work. The issue that we have is we don't know when, because this is still evolving. So we don't know exactly when that person is not infected. So they should be wearing a mask for at least 14 to 28 days after they're symptom-free. And they should get tested. So even for the people that are in the office that are concerned, you should also be wearing a mask because you don't know when you're going to be shedding. And on top of that, if you're symptomatic, you should be coming to work and you should go get tested.
Yeah. Okay, let's, is this Gia from Wantagh?
Hi, yes. My question is, what accommodations are being made for the essential workers and to coordinate times for them to get tested since they're working these long, arduous hours?
Well, it depends which essential workers you're talking about. If you're working in the facility or like in the hospital, even in a hospital like ours, you can get tested. We have an employee health, and we're able to do that, whether you're symptomatic or not. But we try to make sure that we test, we try to save the majority of the tests for patients who are sick and who have symptoms. But if you're an essential worker and you're concerned, you should get tested.
So, Doctor, following up on that, I know that there has been some recommendations that maybe people should have their temperature taken before they come into work, and maybe that's a way to kind of weed out who might have the virus. Is that something that NUMC would apply?
We were doing that initially, but again, you could actually be infected and not have a fever.
Yeah, that was really my question. If you're asymptomatic and you don't have a fever, you could still have the virus, right?
Correct.
So, okay.
So that's why everyone is being asked to mask.
To mask, right. Okay. Let's go to Michael from Garden City. Michael, you there?
Hi, how are you? Hi, doctor.
How you doing?
I'm doing great, thanks. First of all, thanks very much for you and all the other healthcare providers that are out there putting themselves in harm's way on our behalf. It's very much appreciated. My question is, there's a lot of different facts or a lot of different discussions of going to the grocery store. When you come back from the grocery store, do you have to wipe your packages down? How long does the virus actually last on different surfaces? I've heard things from 2 hours to a couple of days. Is there any clarity to that, or do we just not know?
Actually, we don't know, but we know that it can stay on surfaces for a long period of time. So the answer is yes, you should be washing everything down.
Okay, great. Let's go to Daniel from Sayville. Daniel? Oh, Mary. Is this Mary from Sayville?
No, this is Mary from Lindbergh.
Okay, well, I didn't have that down. What's your question tonight?
Well, actually, it's related. When they're delivering food from restaurants, I've got two questions, and I thank you for taking these questions from the public. do you have to wipe down the outside of the bags, the boxes inside? And is soap and water good, if it's good for our hands?
Soap and water is always good. If you're washing your hands, you have to wash for at least 20 seconds. It's always safe to wipe things down because it's on the surface, and it can stay on the surface for a while.
Okay. Now I think we have Daniel. Are you there? Daniel, you there?
I'm there. Can you hear me?
I can hear you. What's your question tonight?
So I first have to agree with the social distancing initiatives that are going on, and I really think they're helping a lot. But I also think there's a mental health piece that is associated with this whole COVID-19 pandemic, and it's things like going outside of the house. We see people walking around with their family, and I think that's really great. But when do you think it's safe, doctors, to start resuming outdoor activities, things like maybe golf, a sport where you can social distance quite easily? And I'm not sure if you agree or disagree with the state's order to shut down golf courses. Just wanted your opinion.
You know what? I'm not 100% sure, but as long as there's space in between, I think that's fine. I think we're concerned about everything else besides, because the golf course is actually pretty wide, and there's space between golfers. But it's the ride. If you're walking, it's different than if you're on a golf cart. So there's multiple factors in this.
So, Doctor, following up on that, the governor said May 15th he wants to keep everything shut down. You think that's adequate from what you're seeing as far as plateauing?
Yes. It actually makes sense because right now we've been really, really good. There are people who've been inside for a long time and are protected. Because there's no vaccine, when some of these guys come outside, and there's no social distancing, and they may be vulnerable.
Okay.
So they've stayed inside, and we've done a really, really good job at this time.
Okay. Social distancing may become the new normal until we get a vaccine, so that may be going on for a long time. We're going to take a really quick break, and we're going to have much more expert advice on how to keep you and your family safe from the coronavirus. And remember, we do want to hear from you. Call us now with your questions. The line may be busy, but call back. That number right there at the bottom of your screen, 516-393-1800. We'll be right back. Welcome back to our live coronavirus pandemic special report. Let's bring back in our expert, Dr. Anthony Boutin, Chief Medical Officer at NUMC. Doctor, I appreciate your time again, as always. Let's go straight to the phones because we have a few people that are actually on hold right now. Rose from South Hempstead. Rose?
Yes, hello?
Hello, what's your question tonight?
Doctor, yes. My question is, after wearing a surgical mask briefly, can I wear it safely again after rinsing, drying, and storing it for about a week, assuming that then the virus would be deactivated?
Doctor?
I don't understand the question.
Are you asking it? I think she's asking it whether the surgical masks that people can get, the disposable ones, if they can be reused, if they were just washed.
The surgical mask can be used. It's protecting you from others. It's not really, as long as the mask is nicely fitted, it's protected.
Okay, great. Lynn, are you there, Lynn?
Yes, I'm here.
What's your question tonight?
Hi, doctor. I just want to thank you and your staff for everything that you're doing during the pandemic. My question is, if I'm infected with COVID, can I be reinfected again?
It's not clear, but the answer is, so far, the evidence shows that the answer is yes. But it's new. We're not 100% sure, but from listening to what's happening in China, the answer is yes. Okay.
Doctor, let me ask you this, just kind of going back to the masks. How are you at the hospital, how are you guys doing on the PPE and ventilators? You have enough?
So right now the answer is we have enough, but we have to make sure that we have enough for next week, next month. So we try not to waste it. Thanks to donations from the public OEM. We have tremendous amount of PPEs for our employees. So we're doing really, really good so far right now.
Okay, that's good to hear. Linda, are you there?
Yes, I am. Thank you. First, I'd like to thank Dr. Boutin and his staff for everything they're doing. I have two quick questions. My first one is, do you feel that we are at a plateau, or at least close to the plateau? And my second question is, if I'm out walking my dog and I'm walking the dog by myself, is it necessary to wear a mask at all times?
The answer for your first question is, it looks like we're at a plateau, and the plateau may last for a while. So whatever we're doing, we should continue doing it. And we're doing really, really well at this point. And if you're walking your dog and you're by yourself, you should get accustomed to wearing your mask, so that it's the new normal at this time. So I would encourage everybody when they go out to wear their mask.
Okay. Greg, are you there? Greg? Greg? Oh, go ahead.
Yeah. Hi. My question is, if you get the virus and recover from it, can you still carry the virus and spread it to others?
The answer is yes. Even after you recover, we still don't know how long you're still shedding or still infected. So again, it's recommended that you wear a mask for a while, 14 to 28 days, and to see if we have the ability to test. You can get tested at some point and see if you're still, positive or negative. But the answer is yes, you're still infectious.
Yeah, that's a scary thought right there. Terry, you there?
Yes, I am. Thank you for taking my call. I'm a registered nurse, and I run a healthcare facility for developmentally disabled individuals. And when you're living in
I think did we lose Terry? Let's go to Lisa from Huntington and try to get Terry back. Lisa?
Yeah, hi. I was tested presumptive positive close to 2 weeks ago, and now I redid the test and got tested as negative. Do you have any idea what that means?
Well, the test that we have, it depends what test you're doing. There's false negative and false positive. It all depends if you have symptoms. At some point, when we're doing the antibody testing, we can actually tell, depending on if you made antibodies or not. What I would always do is assume that you probably are positive and just be careful, wear a mask. If you have symptoms, just take care of yourself. And if you become short of breath, then I would seek medical attention.
Doctor, are we going to end up needing to be tested every day if we're going to work and bringing the economy back?
No, not every day. I think once we get the antibody testing, we'll be able to know. It may take us a while to get the rhythm, but we'll be able to know how many people have antibodies and are safe, and how many people need to be protected.
Okay. Well, unfortunately, we're running out of time, but I want to express my thanks to you as well, and from everyone here at News 12 and everyone on Long Island. You guys really are the heroes. You're on the front lines. We appreciate everything you're doing, and I certainly appreciate the fact that after a long day and you doing everything you're doing, that you come here and do this public service. So thank you so much, Doctor. And thank you. Yeah, thank you, viewers, too, as well, for all of your calls. And we'll be back on Monday at 7 o'clock, so join us then.